the G of AKBC, of course, the chairman of NUJ, Akwa Ibom State, you're all welcome to this periodic briefing organized by the Ministry of Information and the Office of the Chief Press Secretary to the Governor of Akwa Ibom State. And today, we have in our midst the Honorable Commissioner for Health, Akwa Ibom State. I think it should be given a round of applause. The essence is because for the first time in a very long while, we are seeing him walking without an extra leg. Without much ado, I will invite to set the template the Honorable Commissioner, Ministry of Information, Honorable Anekan Umana.
Thank you very much. The Honorable Commissioner for Health, our most erudite and ebullient Dr. Ikem Emmanuel John, Chief Press Secretary to the Governor of Akwa Ibom State, my brother and friend, Ekeri Todo, Permanent Secretary in the Ministry of Information, Senior Special Assistant to the Governor, Directors General, Directors, Chairman NUJ, Gentlemen of the Press, ladies and gentlemen. On behalf of His Excellency the Governor of Akwa Ibom State, and indeed the government and people of the state, we have the honor and privilege of playing host to the gentlemen of the press this afternoon. I'd like to first welcome you to the August edition of the monthly Ministerial Media Briefing of the government of Akwa Ibom State. So it is my pleasure, like I said, to warmly welcome you to this edition, and we are delighted to have with us here the chairman of the NUJ and heads of respective arms of media organizations in the state here present. The media remains an indispensable partner in governance, not only in informing the public, but also in asking the right questions, providing constructive scrutiny, and helping government communicate its policies, programs, and achievements to the people. Today's briefing will focus specifically on healthcare delivery reforms of the government of Akwa Ibom State under the leadership of His Excellency Pastor Umoino in the past 3 years and some months. But before we yield the floor to the Honorable Commissioner for Health, Dr. Ikem Emmanuel John, to tell us what the administration has achieved in healthcare delivery and reforms in the last 3.5 years, I'd like to briefly set the context. The administration of His Excellency Governor Umoino believes that governance is not complete without the people understanding what is being done, why it's being done, and most importantly, how they are benefiting from it. This is the essence of this monthly briefing, to allow us engage with the people, engage with the media, and allow questions to be asked for proper explanations to be made to the people. But before we go into all of that details, I'd like to use this opportunity to once again reiterate what His Excellency the Governor had made public last Sunday during the Thanksgiving, the Victory Thanksgiving service that followed the convention in Eket last week. The month of September has been designated the month of gratitude in Akwa Ibom State by His Excellency the Governor of the state. Ladies and gentlemen, gentlemen of the press, as we approach September, we are approaching a significant month in the history of the state, and that is the month of the creation of Akwa Ibom State. 39 years ago, history, growth, sacrifice, and remarkable transformation has taken place under successive administrations in the state, and we are here in the 39th year of state creation. This year will mark the anniversary under the theme Gratitude. It is a month that we will all come together to show gratitude to God Almighty for bringing us this far in this past 39 years. So we'll give gratitude to the Almighty God for His faithfulness, for the peace, the unity and stability we enjoy as a state, and for the men and women, past and present, who have made contributions to the growth and development of Akwa Ibom State. But our gratitude will not be expressed only in words, because as part of the 39th anniversary of Akwa Ibom State, 39 projects will be commissioned in 30 days of September. From September 1 to September 30th, a total of 39 projects will be commissioned in this state. I'm reiterating what His Excellency the Governor had earlier announced, just for clarity, so we get prepared and then put on our commissioning shoes, because it's going to be a very busy month for all of us. Projects spanning across roads, healthcare centers, schools, hospitals, if you like, airport facilities, youth development centers, model schools, model health centers, and so many other projects spread across the 31 local government areas will be commissioned. And of course, the full details and list of the projects will be made public as soon as the Secretary to the State Government announces officially the program of activities for the 39th anniversary of the state. We're also expecting to host the special state anniversary Thanksgiving service on the 20th of September 2026 at the International Christian Worship Center here in Uyo. And of course, on September 23rd, when is it? September 23rd, 2026, that is the anniversary day proper. Of course, a variety night, or what you call the anniversary banquet, will hold at the banquet hall of the Audacious Arise Palm Resort on the 23rd of September. I just thought I'd use this opportunity to throw a little light on this. It's also expected that His Excellency the President of the Federal Republic of Nigeria, Senator Bola Ahmed Tinubu, GCFR, will visit the state sometime in September. The date will be made public to also commission some projects executed by the administration of His Excellency Governor Omoeno. This expected visit underscores the growing partnership between the federal government and Akwa Ibom State government under Pastor Omoeno in advancing the development of the state. I have also mentioned all of that. The anniversary celebrations, it's what we need all Akwa Ibom people to come out and be part of the story of the state. But the key thing is 39 projects for 39th anniversary and in 30 days. God helping us, Akwa Ibom will be celebrated and will be the toast of the world. But in all these 3.5 years, by way of summary, as we celebrate the 39 years of state creation, it's also important to acknowledge the impact of the administration of His Excellency Governor Omoeno in Akwa Ibom State in these past few years. The administration has developed a philosophy that has remained very firmly people-centered, ensuring that it's investing in those things that will transform the lives of the people. Whether it's workers or retirees, you are aware, I won't tell you the stories of gratuities that it took up at 101 billion outstanding from 22 of all the way till when he took over in 2023. And as we speak to you, he has cleared over 90.6 billion from 111 billion. So it's leveling out, because the plan was to level it out and also see how we can now bring it to parity, so that as people retire, and they will be getting their gratuities as and when due. All of this going on side by side, but of course, you know the story of the minimum wage. Akwa Ibom is ranking one of the best in the state, because it's even above the benchmark, and so on, and so many other things that have gone on, even in recruitment of workers and the civil service and in the healthcare sector, which the Commissioner for Health will shed more light. Infrastructure, in terms of infrastructure, we have in our kitty over 1,300 kilometers of roads, already done, some commissioned, some ongoing in the state in these 3 years plus, and about 41 bridges in different parts of the state. There's so much going on in the aviation sector. Akwa Ibom has become the toast of the world. From the new terminal at the Victor International Airport was recently completed, and of course we started the international flight that launched into Accra, Ghana, and running now on a weekly basis, taking all the way to the recent conclusion of arrangement for the 3rd Airbus A220-300 series aircraft that His Excellency did a pre-shipment inspection. I'm happy to also announce to you, I'm sure you've seen Ibom Air release, that the aircraft, the TOT is complete and the aircraft is ready to be on its way to you. And this in addition to the aviation village development, the airport, hospital, the runway completion, the lighting, the aerodrome lighting, security facilities, and so on and so forth going on in the airport environment. We can go on and on and on. Across the 31 local government areas, there are projects everywhere, whether it's roads, hospitals, health centers, all of those are going on. So it's something very, very exciting. The Commissioner for Health just reminded me that today is for health. I said he will have his time. I just thought of giving you an overview. Yeah, because it's important, because there are areas you may not remember to touch. So we can go on and on and on and on. And I'd like to say that the educational sector is also experiencing this boom. You can see what's happening even with the students' bursary. With the students' bursary. Recently, over 1.9 billion naira was released for student bursary, and they're assessing it apart from the increment from 20,000 naira to 50,000 naira per student. And then, of course, examination fees and so on, over 6.8 billion has been spent on so far supporting children in schools in paying, and parents in paying examination fees, whether it's WAEC or NAPTEC or other forms of examination fees. In 3 years, 6.8 billion. When people are asking, that's money going directly to the people. And that's why we said that the governor is running a people-centered administration. Humanitarian intervention, it's boundless here. As you can see, the Arise Compassionate Homes, 461 have been completed so far out of 500 earmarked, and so on. Free food distribution, over 800,000 households have so far benefited. Human Capital Development Index is growing in its leaps and bounds, and a lot that we can talk about. We will take your questions later and allow you share your thoughts, but I just thought that we should give you a little bit of an overview to see what's going on in the administration as we begin to wind down, so we can yield the floor to the Honorable Commissioner for Health to tell us about the healthcare reforms that followed the medical emergency that His Excellency the Governor of Akwa Ibom State declared not too long ago. Gentlemen, I would like you to sit back, listen calmly to our very, very brilliant Commissioner for Health, who will take us through the developments and accomplishments in the healthcare sector, and then we will take questions. Thereafter, we'll take the closing marks. I thank you so much for listening, and may God bless us all. Honorable Commissioner for Health, I will yield the center seat for you, so you will now take the stage and brief the press. Thank you so much.
The Honorable Commissioner for Information, Chief Press Secretary to the Governor, like to call him record-breaking Chief Press Secretary everywhere in the country. I think he has the singular distinction of being a third-term CPS. You should appreciate that. Let me also recognize the Permanent Secretary in charge of the Ministry of Information, Senior Special Assistants to His Excellency the Governor, and Special Assistants to the Governor within the media sector, personal assistants too, and of course, the chairman of the Nigerian Union of Journalists. The thing that Dr. Esendueso did not say is that the NUJ and indeed all media practitioners have decided that they will give me a brand new car plus 2 cars for working without the third and fourth leg. To God be the glory. I'd like to thank you very much, ladies and gentlemen, for coming. I'm delighted to have this opportunity to speak to Akwa Ibom people about healthcare delivery in our states, and particularly the ongoing transformation of the health sector under the leadership of His Excellency Pastor Omobasieno, PhD. The most important point I'd like to establish from the outset is that His Excellency isn't just implementing a program of building and renovating hospitals, but is hell-bent on taking deliberate steps to ensure that the entire health sector performs. Usually I like to interact with us. We just ask questions and then we just say them. And I say this because many years ago I read a statement by Gandhi after he addressed the British Parliament for a while. And they said, you didn't forget anything. He said, because I spoke from my heart. Often when I engage the media, I like to speak from my heart because that way I don't have to remember anything. I just have to, but my 2 big brothers here have constrained me that I should put thoughts to paper. So in case I forget anything, hold them and not me. But I think during the question and answer, whatever I leave out, we'll be able to discuss. One of the challenges with healthcare is that a lot of what we do isn't brick and mortar. It's not cement and wood. Some of the things that we do and are expected to do within the health sector are usually very expensive, but many persons in the society cannot, literally speaking, point to it. I'll give you an example. We just finished the malaria net campaign. 16,500 Akwa Ibomites were engaged in that net campaign. It happened as a collaborative effort of the U.S. government of Akwa Ibom State, Federal Ministry of Health, and then the Against Malaria Foundation. Over 20 billion in expenditure, but many of us would not appreciate that. So His Excellency has made very intentional investments within the health sector. And because they're not brick and mortar, a lot of us do not understand. And that's why I'm here. We're going to address all of the questions. Let me also say that the governor's guiding vision is to build a resilient, accessible, affordable, and high-quality health system while positioning Akwa Ibom as one of Nigeria's leading destinations for healthcare. And that requires us to simultaneously deal with governance, manpower challenges, primary healthcare, hospitals, equipment, medicines, health insurance, emergency medical services, maternal and child health, epidemiology and disease control, public health security, quality assurance, data technology, even the regulatory laws, training, research, and healthcare financing. So when you take the health sector as a whole, it's a whole lot. And therefore, in setting out to pursue these reforms, our reform architecture rested broadly on 6 pillars, namely effective governance, human resources for health infrastructure and equipment, health security, quality and equitable care and healthcare value chains. That's where you talk about medicine supplies and all of that. And we envisioned that we would need 3 critical enablers to ensure these pillars function. Number 1, financing. Number 2, data and digitization. And number 3, building a new organizational culture, not just at the Ministry of Health, but all of the MDAs under the Ministry of Health. So today, rather than merely listing projects and walking away in the next 3 minutes, I'd like to show you what has actually changed. Let's start with governance. You recall that last year His Excellency declared a state of emergency. But what was clear at that ESCO meeting was that isolated interventions wouldn't be sufficient. We needed a whole of the system response. And that is what we set out to do. So we introduced systematic facility monitoring, monthly and quarterly supervision and supervisory visits, performance indicators for the health of these facilities. So for all of our secondary health facilities now, the heads of those facilities have their KPIs. I'll give you an example. Last month, about 12 heads of facilities did not send in their service delivery data. They had to answer to queries because it is now institutionalized as part of their key performance indicator. This has now brought about greater accountability from hospital managers. For example, all our hospitals know that if you lose any patient, the Ministry of Health must be notified through a mortality report within 48 hours, irrespective of cause of death. And the entire reason is we're not being judgmental, we're being accountable. And let nobody make any mistakes. A lot of times when people lose patients, they just go to Facebook and they say, oh, that hospital is a death trap. And last year, I presented our reports in this hall. We had nearly 600,000 hospital visits. And the percentage mortality of people who went to our general hospital was less than 1%. Anywhere in the globe, that is a good result. But I understand the cultural setting. No one wants to lose anybody. But I urge gentlemen of the press to understand that wealth doesn't, there's a Yoruba saying that says, wealth does not knock on every door. Prosperity would not visit every home, but death will visit everyone. And therefore, join us in enlightening our people. For every single death recorded in our hospitals, you have more than 1,000 lives saved. And I do not exaggerate. You don't need to believe me. In the last 3 months, in the last 2 months, we haven't had a mortality from Ikorekpene. But if you go there as we speak, you would have more than 1,000 patients. So what I am trying to say is that under the leadership of His Excellency Pastor Moino, we now have increased accountability within the health sector. And still, as a result of governance reforms, amongst the bills signed by His Excellency, State Emergency Medical Service and Ambulance System. When we started, it started as a policy, but it is now an agency established by law. Through this law, the state government has now criminalized and outlawed the use of ambulances to carry corpses. You remember that we had a struggle getting people to use the ambulance systems because people were used to seeing ambulances going for burials every weekend. I dare say that in the last 1 year, 6 months, under the reform of His Excellency, we have returned our ambulance operations to the levels you find in the Western world. You would not find any government ambulance at any burial site. But let me use this opportunity, and I beg the press to please announce this. The law is very clear. Whether it is a privately owned ambulance, a mission ambulance, or a government ambulance, you cannot carry corpses. Corpses are carried by us. And when you now use our ambulances for the carriage of corpses, you are creating a public health threat to the rest of the public. And the law now empowers that government can impound that ambulance And so let people know that when they go to hire ambulances for their burials, those ambulances could be intercepted on the road. And if you know me, I love my job. Once we pick the ambulance, we'll give you the corpse and take the ambulance. So that's part of what we've been able to do. But the good thing is that census has been institutionalized. 9 other bills have been sent to the State House of Assembly covering areas like hospital governance, primary health care governance, public health security, HIV prevention, protection, and anti-discrimination, health facility standards and regulation. That is a bill that is very dear to the heart of His Excellency the Governor and the Ministry of Health. Once that health facility standards and regulatory bill comes into law, then that agency will have a right to prescribe minimum acceptable standards for all health facilities, be them hospitals, pharmacies, whatever. And the hospitals would now be required to meet certain obligations before they can operate. And that way, everyone will come under regulation. We can then start talking about the quality that we're talking about. In terms of training, His Excellency is also doing a lot there, paying medical residents a training fund every year to the tune of 1 million per resident doctor. So I think that there's so much that has gone on in the last 1 year. Also, still under governance, the Ministry of Health, at the directive of His Excellency, created the Health Ombudsman Office. And since creation, we've received over 600 telephone calls, including over 167 specific health-related complaints. Gentlemen and ladies, you are all in the media space. You know the role of the Ombudsman. We borrowed that terminology from the media space, and it's working for us. We found out that healthcare is a service sector. People will interact with people. People will get offended, either rightly or wrongly, by the perceived quality of service they have received. If you do not have anywhere for them to vent, then you're not sure of quality assurance. So right now, if you walk into our hospitals and you feel that you have not received satisfactory care, you can call those numbers and they would respond. For those of you who do not know the numbers, if you just Google Akwa Ibom State's public complaint hotlines, put it in now, 2 numbers will pop, save them, and you can use them. In terms of Pillar 2, which is our human resources for health, you would agree that buildings do not treat patients. Health workers do. The governor recognizing this and also recognizing the global problem of human resources for health. That challenge isn't an Akwa Ibom problem. It is not a Nigerian problem nor an African problem. It is a global challenge. So if Akwa Ibom state government advertised today, for example, and say, we want to employ doctors, Akwa Ibom state is not competing for doctors with Ekiti or Abia or Lagos state. We're competing for doctors with UK, US, Dubai, because everyone is sourcing doctors from the same global pool. The thing about medicine is a trained doctor licensed in Nigeria can choose to do the exams in any country and also be licensed in that country. The curriculum is nearly universal with just a few tweakings. So when we go to the market fishing for healthcare professionals, and people call me and say, we are only able to recruit 50. We did recruitment the other time and we had 59 persons. I went to the quarterly meeting of commissioners for health and I complained. And my colleagues almost ate me and said, you found 59 persons and you are complaining. Where did you find them? It's a phenomenal challenge, but we are addressing that. What are the things that the governor did? The first thing was welfare review. So our healthcare workers went to bed one night and woke up the next morning, and their take-home pay had been increased, depending on cadre, from 30% to 40%. So imagine someone earning 1,000 naira, waking up the next morning and it is 1,400. Someone taking home 1 million naira and waking up the next morning, it is 1.4 million. It may not be El Dorado, but it is significant. And throwing that welfare package in, many people got interested. I can tell you one thing. Before the welfare package reforms by the governor, people were resigning from our service nearly every week. They are still resigning, but it is now happening once in a while. And so we have some bit of respite. And we hope that the economy remains stable and inflation does not wipe away the gains so that the healthcare workers can stay. And that's why we're happy with how Mr. President has managed and stabilized this economy. Following this review of the welfare package, we advertise and have concluded the recruitment of nearly 3,000 healthcare workers, specifically 2,854 healthcare professionals, with the 854 component being retired but not tired healthcare professionals who have now been offered contracts and they've already been deployed to many of our hospitals. And so in the next 1 month, you would see a surge in the number of healthcare professionals in our health facilities. We're taking this one day at a time. So, but I want us to understand something. Our response cannot merely be classified as recruitment. What we've done within the last 1 year is to recruit, train, deploy, and then incentivize, motivate, so that we can retain, and then we are monitoring. I already talked initially about our governance system, weekly, monthly, quarterly monitoring, and then the reports. We're not stopping at that as part of training, because some persons have left and jackpot because they've not had opportunities for growth. Under the state of emergency, in the last 1 year, we have had substantial training for healthcare professionals. We've invested substantially in the training of our healthcare professionals. We conducted trainings for 713 primary healthcare workers on the use of data for decision making. We trained 1,959 healthcare workers on family planning services. And when we begin to talk about the data sets for family planning, you will see how this training has helped us and improved the use of modern contraceptive and increase our contraceptive prevalence rate as a state. 600 nurses have also been given CPD opportunities, continuous professional development opportunities. And then we've trained over 530 persons on the operations of our drug revolving fund. I'm also going to talk about this because significant to this is the governor's investment in our drug revolving fund, such that in the last 3 months, we do not have drug stockouts. I tell you this, and I'll kid you not. If Ima is there, let him check my car. He will see a green file. And I'd like to show you, just yesterday, I got a report from our central medical stores. As at this morning, as at yesterday, apart from the medications that have been sent to all our primary health care centers, all our general hospitals, we have medications worth over 800 million, nearly 1 billion in our central medical stores. Thanks to His Excellency the Governor investing to ensure that there are no drug stockouts of essential medicine. I'd like to add a caveat here, because some persons who are very mischievous will go out and then now ask for one particular drug is not there. I used my words carefully as a professional. I said essential medicines. Nigeria has an essential medicines list, and states have domesticated this. So if you go tomorrow and you ask for a drug like Altiplace, for which one vial, one injection is around 1.3, 1.4 million, and they tell you it's not available, please don't write sensational stories and say, oh, the commissioner said this. Altiplace is not on the essential medicines list. Those are specialized medications. We've also trained nearly 1,000 skilled birth attendants, about 956, over 100 junior CHUs, and then 656 community surveillance officers. Again, how is this important? Throughout this year, last year we had over 35 cholera outbreaks. Throughout this year, we've not had an outbreak. We've had reported outbreaks somewhere around Ibiono. But after testing, it turned out that it wasn't an outbreak. So up until last week, when we had a case of Lassa fever, our epidemiology unit, in fact, during our joint annual review, we gave a standing ovation to the state epidemiologists, because that unit had not recorded a single outbreak since January till June. Now, that is not a product of accidents. It is a combination of funding by His Excellency the Governor, support from development partners, this training that we are referring to, which has strengthened surveillance, and that's why we have that kind of outcome, right? So I think if we are not having this conversation, you would not be able to correlate how that training guarantees health security for Akwa Ibom. That's why I said a lot of what we do in the Ministry of Health is not brick and mortar. Pillar 3, where we focused on, is the primary healthcare revitalization. You already know what we're doing with primary healthcare. The twin foundations of university health coverage is primary healthcare and health insurance. A properly functioning primary healthcare system would manage most routine healthcare needs and manage them very close to the people. I dare say that since the creation of Akwa Ibom, no governor has been as intentional as investing in primary healthcare as His Excellency Governor Pastor Moino. And this is with the greatest respect to all of our leaders who came, did their bit. This is no comparison, but it is what it is. And as healthcare professionals in the field, we are excited and we are very happy. Well, His Excellency is currently building at least one model primary health center in all 31 LGAs. And I use the word at least advisedly, because there are some local governments that have 2 and some have 3. And that's entirely based on needs. So as at now, 19 of those PHCs have been completed. About 3 of them are due, 3 or 5 of them, I'm not exactly sure, are on the list for commissioning in this September. So we're very excited, we're very happy. As a matter of fact, we slowed down with our primary health center at some point because of the paucity of healthcare professionals. So, but we've revved up our activities now that we have been able to do some recruitment, and then we're pushing. 29 existing primary healthcare centers have been renovated, and I'll give you some names because I told you would engage. If you go to primary health center Ikoreyo, it's among the last 4 we just renovated. If you go to PHC Ikorudom in Ika, it's part of those we just renovated. If you go to PHC West Itam, just close to you here, you will see that that facility is part of those we renovated, and about 29 of them. These are just some examples. This means that our primary healthcare revitalization program is operating on 2 parallel but complementary tracks. We're building new facilities while we are rehabilitating existing community facilities. Let me make some clarifications, because some of my friends, in fact, one of them is in this hall. He didn't know I saw it 2 days ago. He pointed out a primary health center in Ikono. I'm sure he's going to ask me about that. We have 479 primary health centers. I dare say no governor can, around the states, I dare say no governor can embark on fixing all 479 at the same time. And our people must also cut the government some slack, in the sense that these are things that have happened over a long period. It will require consistent investments over a period of time until we get to our desired endpoint. But do we recognize that there is a problem? Yes, Governor Moino does. Are we taking steps to address those problems and needs? I am showing you empirical data and naming communities to prove that we're doing all of that. So please, my dear friends, be patient with us. We're going to get to your own community. I know that when you drive past and you see that some other community's primary health center has been touched and yours has not been touched, you'll send a WhatsApp message to the commissioner. We're doing it little by little, please. Just farabale some more. But when you go to these PHCs, what are the functional components? We have areas to take care of maternal and child care, immunization, emergency services. And then we're not just stopping at that, cold chain support, but we're also providing staff accommodation. Why are we doing that? The inclusion of staff accommodation is particularly important because the rural facilities simply cannot work if the healthcare professionals do not live reasonably close by. And so we're intentional about that. And all of these facilities, the governor insists that they must be solar powered because some of our rural areas do not have guaranteed electricity. Again, some of the challenges that we find in the health sector are not Akwa Ibom's only problem. They are problems that are nationwide. But thankfully, the state is now taking charge of its electricity sector. And perhaps in another 3, 4, 5 years, we would achieve electricity sufficiency. But I'm happy that in the last 1 month, citizens have acknowledged the efforts of His Excellency Pastor Moino towards guaranteed steady power supply. It has improved significantly and we're doing our best. I already mentioned some of the areas that we've touched. At the secondary care level, what have we done within this period? We've been able to complete 2 secondary health facilities. New General Hospital Ukanafun, that all of you can attest is functioning, the Airport Medical Center. The Airport Medical Center used to be a small clinic, run down. I'm sure that before now, when you go to the airport, that institution stood like an eyesore. You know, it always made me sad every time I was traveling. But today, the reverse feeling is the case. Every time I get into the airport and I turn and I see that beautiful edifice, I feel extremely proud to be serving Akwa Ibom at this time under the visionary leadership of Governor Moino. When you get into that place, NMA just did a release today on their page on Facebook, commending Governor Moino for his investment at the airport medical center. You can look it up. They did a tour of the facility and then they signed off a press release. His Excellency is investing heavily. That facility has 3 theaters and the media is here. Many people have asked me that question. Is it this beautiful hospital, is it restricted only to staff of the airport? No, it is not. We do not shut down hospitals. We do not segregate under any basis who can access care and who cannot access care. So the airport medical center is located in the airport's precinct, but it is for all Akwa Ibomites. It is for all Akwa Ibomites. And I dare tell people that when people find out the quality of equipment and staffing that were put in at that facility, people would leave your main town to go to the airport for care. Because, again, I dare say, as a practitioner, long-standing practitioner in the field, there is not a single hospital, private, around there that can beat what His Excellency has done at the airport medical center. So if you're going to get superior care, you're going to get superior equipment, and then you're going to get a prescient, beautiful ambience for less cost, what will prevent you from taking a 10 minutes drive to the airport to receive that care? I believe conscientiously that that facility will serve a lot of our citizens very well. But we're doing much more within the secondary healthcare space. His Excellency is investing in equipment upgrades. We are upgrading theaters, and some of the facilities where we have upgraded theaters, Emmanuel General Hospital, Leket. As a matter of fact, before His Excellency came, one afternoon, just after then, I served as the governor's personal physician. Just after the governor had come, the med soup of that hospital called me that their theater table collapsed. And it was a problem. But take a walk to that hospital and beg the med soup that if you don't have a patient in theater, can you allow me to just take a peep? You will be proud to be an Akwa Ibomite. Governor Moino has been intentional with his investments in that area. We're also investing in maternity services. Again, I urge the press to educate our women. We did a mortality audit at General Hospital Likod Ekpene, and I dare always use General Hospital Likod Ekpene because that is one hospital that is actually doing the job, but keeps getting into the news for the wrong reasons. And I don't know, in fact, I keep supporting them because they are actually doing the job. And I want to beg our media people, let's refrain from destroying some of our most historical institutions. We did an audit in that facility, and we found out that over a period of time, we had 13 maternal deaths. Of the 13 maternal deaths, all 13 presented at that hospital with a history of having gone to a traditional birth attendant. And then these 13, 5 of them were brought in dead. But because they were brought in dead, and that is the first hospital they are going, the doctor at that hospital will have to certify dead. Again, some of those doctors who would say, oh, let's even try to see whether we can resuscitate, and then they do CPR, and then the woman doesn't come back or does not recover and comes back to life. And then what goes out there is that, General Hospital, it's very hard for a woman who has received antenatal care and under the supervision of skilled birth attendants to lose her life. It's very rare. And when it happens, as medical practitioners, we mourn, literally. Our heads we roll. Whoever is in charge, we read the riot acts. Because in medicine, we define pregnancy as not being a disease, but a physiological state. So, yes, a woman that is pregnant experiences changes in physiology, but she's not sick. And so we don't expect her to die. So I don't always have the opportunity to meet with us like this, but this is a veritable platform for you to commit to saving our women and educating them about the menace of TBS. What more can a governor do? This governor has now instituted free maternal care. Our women who need cesarean sections in our hospitals can be offered that care free of charge. Immediately you get pregnant, just enroll with the state health insurance. And everything about your pregnancy, immunization for the child is covered free of cost. Facilities are provided, skilled birth attendants provided, and then the financial burden taken away. Pray. What else would you want a governor to do that Governor Moino hasn't done? So we're very proud of all of this. He's also invested in CT scans. Google how much a CT scan is by GE. Just say 160 slice CT scan by GE. Then when you look at that price, you look at the shipping cost, and then you look at the haulage cost from the ports, clearing cost, and then you now come to installation costs. And then the pre-installation cost, if you buy your CT scan, you can't come to this room and dump it. You will modify this room. You will lead line this room. You will rewire this room. Those costs runs into millions, several of those millions. And then when you put all of those costs together, within the last 1 year, Governor Moino has provided 2 brand new CT scans for use by the people of Akwa Ibom. You don't need to believe me. Just take a walk to Ibom Specialist Hospital. So gone are those days when we used to go to Umuahia, Port Harcourt, Calabar for such things. Before 2023, we didn't have a functional MRI. But today, nobody is complaining on Facebook, I can't find where to do MRI. Thanks to the deliberate investment in equipment by His Excellency, the Governor of Akwa Ibom State. Not only that, it's brought in an additional 1.5 Tesla helium-free MRI. Now, you wouldn't understand why I had to mention helium-free, but I'll break it down. MRIs frequently break down, and that's why governments and hospitals are scared to buy them. So you buy a machine that costs between $1 to $2 million US, and then it's breaking down every 3 months, right? And then every time it breaks down, you are spending between 50 to 200 million to fix it. What is the problem? Power supply. Because it is cooled by helium gas, which is a volatile gas, evaporating per second. Once power blinks, the gas evaporates. And when it gets to the critical level, you must then bring in people to refill that gas and do other service maintenance. By opting for the latest technology by the Germans, Siemens, helium-free, we are taking into consideration our stage of development in Africa. And so it is our hope that this new acquisition will serve the state for a longer period and more efficiently. Medical oxygen security. Under Governor Moino, before Governor Moino, we did not have anywhere hospitals could get medical oxygen. As a matter of fact, some of our brothers who value money more than God, more than human lives, would bring industrial oxygen from outside the state and give to our people. When His Excellency got to know about this, he insisted that our medical oxygen plants must work. So we rehabilitated the one at Itungba and got 2 new plants at Eket and Ukpomabak. Again, you do not need to believe me. You can walk to these 3 facilities I have mentioned. We have 3 medical oxygen production plants located in the 3 senatorial districts, 7 public and private hospitals in the state. What does this tell us? One of the major lessons we learned during COVID-19 is that oxygen is not simply hospital equipment. It is also an essential medicine. And so by expanding our oxygen architecture, we are providing the capacity to support emergency medicine, anesthesia in our operating theaters, neonatal care, intensive care, and then trauma and all sorts of illnesses. But there's something that many Akwa Ibomites have come to agree would forever be an enduring legacy to the vision and brilliance of Governor Moino, the Akwa Ibom State Emergency Medical Services and Ambulance System. Before this intervention, there was no comparable coordinated statewide emergency medical system. But right now, we have a system that moves from emergency calls to dispatch, to field stabilization, and then to ambulance transport, and then to hospital care. The state currently has 31 ambulances comprising 3 mobile ICU ambulances, 18 advanced life support ambulances, and 9 basic life support ambulances. But we're not stopping at that. We have a command and control infrastructure at our emergency operations center at the Dakada Secretariat. Again, you don't need to believe me. You are journalists working there 24/7, even at night while you sleep. People are taking call duties at that center. And if you put a call across 2 a.m., someone is going to pick. Sometimes people call me and I said, no need to call me. Because if you call me, I will start trying to call the center directly. I cannot call them with my regular phone and deploy them. By law, the only time I am permitted to do that is if there is a statewide emergency. So you've got to call through the emergency numbers so that your call will be recorded, monitored for quality assurance. We use those recordings and monitoring to review our operations. And then when we started, we were picking up people around 25-30 minutes. Today in the urban areas, we pick up people under 10 minutes, max 15 minutes. And even when we pick at 15 minutes, you see our staff apologizing to you. Our aim is to be able to pick people within the urban centers around 5 minutes. Hopefully, we're able to get more ambulances and expand station in more places. And then that is our aim. But at our stage of development, I think that for an agency that is just a year old, we've done so much. But what does this mean? The emergency operations center can do a 24-hour call reception. They can dispatch. Our ambulances are tracked using GPS. So we don't only deploy ambulance. Someone at the call center is monitoring the ambulance for delays and diversion. I use this opportunity to talk to our transporters on the road. As if you're driving your car and you hear an ambulance siren, please give way. By the new law that the governor has signed, if you obstruct an ambulance as a first-time offender, I think the fine is around 250,000. And then a second-time offender is 1 month imprisonment without the option of a fine. The reason is not that anybody is trying to be too strict. It is because a 5-minute delay can be the difference between life and death. There is no reason to be a big man when an ambulance is coming, because when you travel abroad and you hear an ambulance, you give way. If you value the lives of people, yes, we are all one by humanity, but they're a little different from you and far from you, and you value their lives. How about your brothers and sisters, your own kith and kin around? So please educate our people. Educate our people. That service has been able to answer 2,605 emergency calls since inception. They've also been able to transport 1,404 patients and done about 1,900 field stabilization. The agency has now been onboarded into the National Emergency Medical System Architecture, and we are collaborating with agencies like the Federal Road Safety, the Federal Ministry of Health, and all of that. So, what is the new philosophy? Previously, the question was, how does an emergency patient get to the hospital? Now, the question is, how quickly can the health system move to an emergency patient? And Governor Moino has answered that question very brilliantly. But has he stopped at that? I talked about the fact that when you're talking about universal health coverage, you're talking about the twin foundation is primary health care and health insurance. But you can add emergency medical services as a third leg. Now, in terms of health insurance, you are all witnesses to the fact that before 2023, we didn't have a functional health insurance. But Governor Umoino launched one in 2024, late 2024, and we began enrollment and worked very hard starting 2025. As we speak, there are over 230,000 enrollees within 18 months. But it is not just about that enrollment. It is also about what does this mean for Akwa Ibom people? What services have been delivered? There's a lot that we have done, but I'm going to skip all of that and just talk about the services that we have delivered, the summary of the major achievements that we have had. In terms of facilities offering health insurance, we have 325 primary health care centers that have been accredited and they're offering this service, and 120 secondary health care services, including private hospitals. Within the beginning of the health insurance up to now, and I can leave this service utilization data with you. I think I'll leave it with Doctor to take a snapshot and circulate. We have had 622,000 patient consultations. So if you're in this room and you are not benefiting from this, I don't know, you have only yourself to blame. 622,000 patient consultations in 18 months. 3,414 women have delivered vaginally at no cost to them or their families within the period. 1,808 cesarean sections have been carried out with only one mortality. And again, that mortality are due to a lot of extraneous factors. So even if you decide to do 1 over 1,808 times 100, check the percentage. And then you see, we're very proud of the quality of healthcare that the Ministry of Health under Governor Moino is delivering to our people. There are other surgeries that have been done under the health insurance, aside from cesarean section, 1,879. In terms of eye care, 2,954 persons have had ophthalmological reviews, of which 1,350 benefited from medical glasses and frames. Within the period, and I always like to share data because there's nothing to hide. I tell people that the Ministry of Health is not Ministry of Works. Ministry of Works is interacting with road, inanimate objects. Ministry of Health is interacting with human beings. So naturally, as commissioner, I wake up every day. In fact, as my phone is, I keep looking because I expect complaints to come. What is expected of us as an institution is the ability to promptly resolve that complaint, not to pretend like complaints will not come. Because you cannot leave two human beings to interact and you think that at some point somebody will not pick offense by the actions of the other. So within this period, we had 622,000 persons use the service, but we also had 10,269 complaints. Again, is that a lot? Yes. Because if 10,269 people are complaining, it will be everywhere on social media, isn't it? But compare that to the number of persons who have accessed the service. Just do 10,269 over 622,000 times 100 and see the percentage for yourself and see whether that is a bad performance. But let's examine the complaints, because this ministerial briefing is also an opportunity to educate our people. What are the usual complaints? Number one, you hear say, oh, the health facility said that government has not paid. The government is not paying health facility. It is an agency of government, well, part of government, that is paying, but they run in a semi-autonomous manner, with the Ministry of Health just having regulatory oversight. The methodology for payment is not prescribed by Akwa Ibom State Government. It is prescribed by the National Health Insurance Authority, NHIA, and it is one method for everyone. So, two methods of payment: capitation, fee for service. For capitation, all of us in this room subscribe to health insurance. The agency, the Akwa Ibom State Insurance Agency, pays the hospital that all of us are attached to a certain amount of money every month, irrespective of whether any of us goes to the hospital or not. Any month we do not go to the hospital, it is their gain. Any month we go to the hospital, sometimes they may spend more than they received. So it balances out. Sometimes you gain, sometimes you are overwhelmed. But I can tell you as a practitioner that most times the profit is in the advantage to the private hospitals. But like many things Nigerians, the owners of these hospitals sometimes would want to make undue profit. And to scare you and intimidate you, they tell you government is owing us. Government is not owing anybody, because the health insurance has a time frame in terms of regulation that they must pay the hospitals that have provided the service. And those private hospitals, why are they complaining to you? They have grievance resolution mechanism. They can write to the NHIA, which will then force the state insurance agency to pay, if any. There's a mission hospital around us, or redact the name, that had that complaint. So I sent for the hospital administrator and the MD, and sent for the ES. I said, gentlemen, I'm commissioner for health. I keep getting this complaint. What's going on? It turned out that they were not being owed. It turned out that they were not being owed. So when they tell you that, tell them you know how to complain. Reach out to the Ministry of Health. or reach out to the National Health Insurance Authority. What is the second common complaint? People just go to the hospital and say, my deduct salary me 3,500 and at a Neubach. And then they say it with such arrogance that you are on health insurance does not mean that if the doctor does not think that he needs to give you an antibiotic, he should give you an antibiotic. But our people do this. They just walk to the hospital, the doctor assesses and sees that this patient is okay, and says, you don't need it. And the patient begins to make trouble and say, oh, they've deducted my money. Okay, if we give you this 3,500 every month that has been taken from your salary as a civil servant, if you go to buy Augmentin, one card, how much is it? In today's economy, you can't walk into a pharmacy and come out without spending 10,000, 15,000. But your entire deduction in 1 year is 18,000. So I expect that our people will support this scheme to work. Look at the impact in 18 months. Even if you want to pay 5,000 as consultation fee, do the math, times it by 699,000, and you see how much money the state government has indirectly put in the pockets of our people. Then you now talk of over 3,400 cesarean sections, even if you pay 200,000 per cesarean section. So this is a life-changing initiative of Governor Moino, and we're committed to ensuring that it benefits our people maximally. What I expect the press to do is to take up private employers and say, have you insured your staff? Because insurance thrives on numbers. But we're not stopping at that. Last year alone, the insurance agency paid out over 690 million to health facilities. That is wealth creation. That is putting money back into the health system. And so a lot of these things are happening. But let's talk about the other things that is not brick and mortar. Immunization. Prior to now, Akwa Ibom used to be very poorly rated in terms of immunization. Was still not amongst the most performing of states, but were picking up rapidly. Let's take, for example, our Penta 3 coverage for our children. In 2023, when Pastor Moino came in, coverage was at 43%. In 2024, coverage was at 58%. But in 2025, coverage moved, remember, from 23% now to 77%. At our media review for JAR, coverage was hovering around 90-something%. And if we sustain that performance up until December, we may as well hit 90-something%, moving from 23%. Immunization is not just a routine activity. It is protection of Akwa Ibom's future. It is the protection of our own children. It is the sustenance of our culture and our states. Looking at that data, it represents a 34% improvement within 2 years, and within 1 year. And then if you take it in terms of relative increase with the 2023 level, using absolute numbers, it will reflect around 79%. So if you mimic any system and your efforts have moved that system by 79%, I think I can debate that with anyone that this is not something to play with. And the data is similar for OPV vaccines, measles, and all of that. Now, Nigeria has the largest malaria burden. What have we been able to do about it in Akwa Ibom? In 2024, our malaria burden was 30.46%. By 2026, early this year, it had dropped to 15.1%. That's a direct 50% drop in prevalence. Thanks to our partners And let me use this medium to thank Ibom that has every year partnered with the Ministry of Health to carry out sensitization. We're very proud of them for being corporately, socially responsible. And we call on other big bodies operating in Akwa Ibom State to partner with the Ministry of Health and indeed to partner with Governor Moino to deliver health care to our people. We just finished our routine malaria coverage, so I'm not going to speak much about that. But within the same period, pregnant women using insecticide-treated nets moved from 40% to 62%. And then our under 5 deaths, children under 5 dying from malaria-related causes, reduced from 18% to 11.5%. What of HIV? HIV has mixed results. We had the AIS survey released recently, and we know that Akwa Ibom has perennially been in the news for high HIV prevalence. But I'm glad to announce that the prevalence has dropped, first from 6.5% to 5.5%, and then now to 4.3%. But this is where the problem lies. 51% of our people do not know their HIV status. And I was wondering, is this also a government problem? Why can't people just simply walk in and test? HIV is now like other chronic illnesses. I kid you not, I know many persons who have had the disease 10 years. I'm not talking about far, in this town as a practitioner. And I kid you not, they walk into this room, you don't know. So please, let's encourage our people to do testing. The real problem is when you do not know your status. You're going to live carelessly, you're going to spread it. And let me educate. Some people will say, oh, I have HIV, it must go around, let me spread it. You are just quickening your death because HIV is not one strain. You may have HIV type 1, and in trying to spread type 1, you will get type 2. It's not one strain. And then by doing that, HIV is not the only thing that can be sexually transmitted. You can get other things, hepatitis, syphilis, and others. Now, what is HIV's main method? It weakens your immunity. Then you now go and get other illnesses that further weakens the immunity because you think you want to be mean to people. So when we educate, we are doing it from a place of love and knowledge. Please listen to your doctors. So there's so much that has been done here, and I think that even for our family planning, our data shows that our contraceptive prevalence uptake, the use of modern contraceptive methods has gone up. Some of you were there when the family planning technical working group visited, I think, NUJ or the House of Assembly, I can't remember, and they did a press release. For the first time in over a decade, the state government is contributing to the national family planning basket. And we have Governor Moino to thank for that. We no longer have stockouts. And part of what we have also done is that we have now asked that the insurance puts family planning on the health insurance scheme so that people can access it for free. Again, something that gladdens my mind, I used to feel very bad. The last data had teenage pregnancy prevalence in the state at around 19%. The current data, this has now reduced to around 8%. We're not still there, but we're making progress. What about medicine and health supply? When was the last time you had stock out? Oh, there is no medicine in the hospital. In fact, the last time we had a joint interaction and there were many media people with the heads of the general hospitals, I made it very clear that we have essential medicines. As we're talking to you now, if you go to our pharma grade warehouse, which is behind where you have the old Secretariat clinic, just behind there, you would see that we have drugs that is in the stock worth close to $1 billion. So if you go to a hospital and they say we don't have this drug, and you find that it is on the essential medicine, escalate to us so that we can ask the head of the hospital and the head of the pharmacy units, because it will only be due to one or two reasons. One, poor planning. You are not able to forecast where you will exhaust what you have and bring in another, and that itself is not acceptable in the service. Two is that someone wants to be mischievous, and they will not let that happen. So we thank His Excellency for that level of massive investment in healthcare. But this is where I'm going to wrap it up. Are people actually using our hospitals? Are people actually using our hospitals? When you have done all of these things, are people using them? From what insurance has said, I'll speak to one more thing after this. From what insurance has said, Maoga has pointed out something. In 2024, all our general hospitals had only 68,000 people come to the hospital. In 2024. All put together, 68,000 hospital visits. In 2025, we had 481,364 hospital visits. That gives you about 600% increase in patient utilization. There has to be factors responsible for that dramatic increase in utilization. But I'll suggest a few things. One, our people probably stayed away because of lack of money. So the health insurance have come to bridge that. And for that, we thank the governor. Two, our people have seen the investment in terms of healthcare, equipment, and then the fact that there is increased accountability. People now know that if you go to the general hospital, God forbid they behave anyhow. Let me colloquially say they will see anyhow. Right? So people now have confidence that let me go there. If you do anything, I can report to the Ministry of Health. So there is increased confidence in the system. And that is what happens when systems promote accountability. Another possible reason is that the infrastructure is clearly better. Now, if you add utilization from primary health centers, we are now having more than 1 million hospital visits. More than 1 million hospital visits in our public health facilities. And this shows even the revenue targets has been exceeded. So these are some of the things that we've done here, but we're moving from the health system to where the rest of the world is going. The world is now knowing that there is something called healthcare economy. If you've been to Dubai and you've been to the Dubai healthcare city, you would understand what I mean. If you've gone to many of the advanced countries, you would see that healthcare is now being integrated. The value chains are being integrated, and out of it, economies are being created. And the governor of Akwa Ibom is tapping into that. Today, you can take a walk to the area called Ibom Medical City. The anchor infrastructure there is the Ibom International Hospital. I'd like to make this distinction. That entire corridor, that area, starting from Ibom Specialist Hospital to 4 Points, is designed as the Ibom Medical City. And it has different components: clinical areas, residential, and then industrial. To kickstart the project, the governor is starting the clinical areas. We have the Senior Citizen Center that was commissioned by the First Lady, and of course named after Her Excellency the First Lady Senator Remi Tinubu. Then we also have the Ibom International Hospital, which is the anchor tenant there. But we also have Ibom Specialist Hospital. That hospital is growing. The construction of that hospital is going at a very fast rate. And we are confident that by this time next year, the hospital would already be operational. Equipment are already being ordered, and a lot is happening there as we speak. You can take a walk there. Let me use this opportunity to address certain questions. Again, I reiterate, Ibom Specialist Hospital is a part of the medical city. Massive investments have been done in Ibom Specialist Hospital. I already highlighted the CT scan, the upgrade in ICU, and then a lot of investments happening there. Under Governor Moino, over 2.5 to 3 billion within the last 1 year has gone into investing in that hospital. Nobody puts that kind of money in a hospital that you do not plan to operationalize. But the hospital has its own issues, and we are handling those. All right? So we're not arguing about that. So please debunk all of this. People have asked me and said, oh, what you are doing at Ibom International, why don't you do it at Ibom Specialist Hospital? Let me throw it back. If you decide to bring in the kind of equipment that that hospital was not designed for, how are you going to handle the MEP of that? Mechanical, electrical, plumbing. How are you going to handle that? If, for example, our radio oncology, we're putting a cyclotron and we're putting it at the basement underground. For a hospital that is already standing, how are you going to go and put that basement underground? Although the only thing you can do in that circumstance is to knock down the hospital, isn't it? And then begin to build underground. So why knock down an existing infrastructure that can still be used for other purposes just to integrate what you want to achieve when you have a lot of space elsewhere to do that design? I urge you, gentlemen and ladies of the Fourth Estate of the realm, to please ask our people to keep some of these arguments within the presence of intellectual engagement and let them have an open mind. But again, like I always say, we are accountable to the people, and we will always engage whenever we are called upon. I want to thank you immensely, and thank you for your time. God bless you.
Thank you so very much, the Honorable Commissioner for Health, Dr. Ekem Emmanuel John. Thank you very much for that very detailed briefing, data-driven briefing, appropriate numbers reeled out for the press to take home. And I'm sure these details will be consolidated when the Statistician General does his work so that you can see in true numbers as they come and as they get updated. Dr. Ekem, we thank you so much for that briefing and all the clarifications you have made. Now, for the gentlemen of the press, we will take your questions. I'm sure you will not have much questions because so much grounds have been covered. So much grounds have been covered, but if you have a question, please indicate as it concerns the presentation and then ask your question straight. We need to wrap this up in the next 20 minutes because we actually scheduled 2 hours for this event. Thank you. Please go straight. Just say who you are, where you work, and then where your question is going so we can take that and act very quickly. Thank you. Yes, say who you are and where you work and your question. Thank you. Thank you.
So I said that so far you've received 10,269 complaints from the health insurance scheme. I would like to know how many of these complaints you have resolved and how many have remained unresolved. Then I would also like to know how you are tracking the quality of services provided by these healthcare facilities that are under health insurance scheme. Then you say that pregnant women using insecticide-treated nets move, the percentage of them using the treated nets move from 20% to 40%. I would like to know how the validity of this data. How do you get this data? Is it by the number of nets distributed, or how did you come about this percentage? That's my question. You say that so far that you have had up to roughly 1 million hospital visits, and out of over 7 million Ibomites in the state. And then you also say that you've exceeded the revenue targets for the ministry. If I may put it like that, I would like to know whether you have revenue targets by the government.
Next question. We'll just take them in sets. Next question.
Good afternoon, everybody. My name is Isaac Joe. I write for the Sunday Paper. Sorry, question is my concern is if people residing in rural communities, how do you handle this reform in terms of the ambulance services and other medical agencies concerning the nature of their community? I mean, riverine communities.
Thank you. Riverine and rural communities. Yes. Next question.
Good afternoon, Commissioner. My name is Basi. I work with Ministerial. My question is to Commissioner for Information. Recently, we saw the report that the NEC has transferred regulatory powers to the Akwa Ibom State Electricity Regulatory Commission. I want you to tell us what this means to the plan by the state governor that there will be effective power supply for the people of the state in 18 months. Thank you.
Yes, that's it. Can we take the next question so that we can wrap up all? Yeah? Okay. Yeah, let's focus on health, but first, and then if there are other issues, we'll attend to them. We've noted that of electricity. I'll take that. Yes?
Thank you very much, Commissioner, for information. This question is directed to you, sir.
Okay.
Because before we commence the briefing by the Commissioner for Health, we had an amount of clarity on some of the issues that was raised or some of the things that was done by the government. So, sir, I want you to just give us a little update on the, because we are celebrating the 39th anniversary of Akwa Ibom State. So, can you give us an update as regards the Bangladesh sequence?
Yeah, that's fine.
signed a new law. It is now a criminal offense to transport cops using ambulances, be it government ambulance or that of a private institution. Please, but I didn't really get the alternative.
He explained it, so but that's fine. Okay, we will allow the Honorable Commissioner for Health take the questions, then I will intervene, and the other unrelated questions are not related to health. Thank you.
Thank you very much, ladies and gentlemen. Mr. Dan, the government just created a business opportunity for you. You can import these airs, and because death is inevitable, there would always be burial, and there will be business for you. All right? But that the principal aim was public health security. Is that okay? And I think you should be happy that some of the things obtainable in Europe are now obtainable in your own state. Change is not easy. People will grumble, resist, but people will comply. And any day we want to seize any ambulance carrying a corpse, we will invite you so that when we take the ambulance, you can take the corpse. Thank you. Ambulances for riverine areas. Isaac, that's a very important question and very critical questions. And I can tell you for free that myself and the state coordinator of the ambulance service were looking at it. As a matter of fact, it is captured in our annual operations plan for 2027. But there are many challenges. You know, this state once owned an ambulance service, Riverine. But it's not enough to buy a boat ambulance. You need to train operators. I don't know whether you understand that. We need to train operators from the drivers of the speedboat, and you know you are not going to have one driver. You would have several because they run shifts. From the drivers of the speedboats to healthcare workers who are willing to walk on water. There are people in this place that if you ask them to travel, not walk, just travel for 30 minutes from Oron to Calabar, they will reply you, "Ken Mongan MK Cup." You understand? So there are lots of logistic challenges, but we recognize that problem and we're looking at the best way to address the problem. We're optimistic that in the shortest possible time, we'll find a solution that is workable for everyone. My brother Kufre took off the crest. Thank you. It's been a while, I've not seen you. Yeah, since you started making money, I no longer see you. But when we finish today, you are going to give me some. How many of those complaints have been resolved? It's very simple. I just refer to this document. And it's from the Health Insurance Agency. $10,243. I'll not be able to say exactly those who are not resolved, but I can guess a few things. One, people complain to the ministry, and you know we have 2 complaint channels for health insurance. The agency itself has its own complaint lines. Just this morning, someone came to visit me as early as 7. He said he wanted to catch me at home. And then when we got talking, he brought up this complaint about health insurance that somebody complained to him. And my younger brother was there, so I know he has the health insurance, and he always goes around with his card. I said, "Give me the card." He gave me. I turned the back of the card. The insurance agency had put their public complaint lines at the back of the card. So that if you go to service, you don't need to cram the phone lines. Just turn to the back of your card and make the call. A lot of our people just like drama. I'll give you an example. Someone came from diaspora, had complaints, I heard about it, and I sourced for her number. She didn't come to me. Called her, introduced myself as Honorable Commissioner. I said, I heard you were dissatisfied with our service. I would like to meet with you so we can resolve. She said, oh, that was a good thing, and she was coming to my office. And she took a lot of my time. I can be patient with people, especially when there are issues and I want them resolved. And she left very happy, right? But she went back and complained to someone who knows me back in America that, I treated her badly. And so the person said, that's not John. If you say that he spoke with a loud voice, that's his natural voice. If you say he was firm, that is him. But if you say he was disrespectful to you, that is not him. So she called me and said, John, you're on speaker. I said, Auntie Adode. He now told me, immediately said, I mentioned the person's name. I said, I remember her very well from her back. He said, yes. And said, we talked. And you know what was her complaint? She came to me, and immediately she came to me. The first thing she said was she wanted to go to social media and do social media live before I called her. So she just wants to warn me that if I'm not going to tell her anything reasonable, let her go and do her social media. I'm a professional, and you're in the office of the Honorable Commissioner, and that's your opening line. If you know my history, you will know that I will not let anybody intimidate me. And I said, Madam, you know what? I am doing this job as unto God for the love of country, for the love of the governor, and for the love of Akwa Ibom people. And I know in my heart that if I leave the job today, no matter what anybody says, I know that to the best of my knowledge, I gave my best. What I am not doing is what has not come to me that we can do. I am the chief policy maker for health. You are in my office. Why are you talking about going to Facebook? Do you understand? You go to Facebook so that you will get my attention. Now you have my attention. So what is the issue? The issue is that some of them just want drama. So when you begin to address the question that they have raised, the concerns, you find that there were no issues. And they don't come back to you because they actually were no issues. Some of those calls actually called to say, I want to check if the phone line is working. You know, some of those things can be very tiring for somebody that is kept to be answering calls. So those would be some of the issues, but I can tell you that any major issue, the agency will not stop until they resolve. Then again, if, like I pointed out earlier, you went to a hospital and there was nothing wrong with you, you demanded for medicine because your money has been deducted and they refuse, and you complain, and they get to the hospital, and the hospital gives them the true position of things. When they get back to you, oftentimes they leave dissatisfied. But there is nothing else the agency can do because the doctor who is prescribing has a professional license and he cannot prescribe under your influence. So those things will be left unresolved for those kind of issues. What was the next question? The next question was ITN usage. We do surveys. How did we get our data? We do surveys. For example, the ITN campaign that we just did now, ITN is insecticide treated nets, that we just did now. About 2 weeks after, Society for Family Health led other development partners to go verify these distributions. So they take the data and randomly visit to see whether they collect. We do surveys, and those surveys are able to tell us, oh, this has been done, this has not been done. So yes, that's how we get our data. How do we track the quality of care for insurance patients? The quality of care for insurance patients is not different from the quality of care for those paying out of pocket. It is not expected to be different. Insurance is not for poor people. Oh, let me make it clear. Insurance is not for poor people, and that's something we think. Insurance is to prevent catastrophic spending in healthcare. So, we do not expect that you will give insurance people a certain level of care and give others a certain level of care. That's discriminatory. It is not acceptable under the law and within the profession. So the question rather is, how do you track quality of care? And I have outlined some of them, both in terms of we are strengthening our laws, we have quarterly supervisory visits, we have monthly reports, and then we have unscheduled visits to facilities. And then we have public complaints lines. Patients can call in and report. Do we have revenue targets? Let me say something here. And it is not about revenue targets. Every healthcare does not target revenue. But you and I know that when you go to hospital and you are not under insurance, you pay money, don't you? And you have complained many times in your newspaper that some of the health staff there are corrupt, they take money. So the government has an idea. If this number of persons come, at least they will pay consultation fee. So that projections is there. It is not that if you don't meet, I'll tell you true life story, so that you don't live with the impression that there is any revenue target. One day we had a meeting with heads of hospitals and somebody was talking. I just sat and he kept quiet. When he finished, I asked him, "Sir, how much is your monthly take home after tax?" He mentioned. I said, "Okay, you are the head of that hospital." He said, "Yes." I turned to him and I said, "Your last 6 months revenue target, revenue collection, look at it. It cannot even pay you." I don't know whether you get where we're coming from. It cannot even pay only you. But you have other doctors working under you. You have nurses working under you. Healthcare is a social service. And the government recognizes that healthcare and education are social services. There are no revenue targets. But it is good governmental and organizational practices for us to have accountability in every system. And accountability includes in how much revenue you generate. I hope I've made myself clear. I thank you very much.
Yeah, thank you very much, the Honorable Commissioner, for that clarification. Very detailed clarification as always. The other question was on the role of the transfer of regulatory powers to ACSEC and the implications for electricity supply for Akwa Ibom State. Yes, correct. On 18th August 2026, it is true that the Nigerian Electricity Regulatory Commission transferred regulatory and oversight responsibilities from the national agency to the newly created Akwa Ibom State Electricity Regulatory Commission, established by His Excellency the Governor of Akwa Ibom State, Pastor Umo Basi Eno PhD, and inaugurated recently. So the agency is at work. So the agency is already meeting one of its set goals of ensuring, in line with the Electricity Act 2023, taking over the electricity market in the state and within an interstate oversight. So that process has begun and the regulatory oversight has been transferred. But what is the implication? It's a 6-month process that will terminate by February 2027. And this was very explicitly communicated in the press release and statement issued by the chairman of ACSEC, clearly stating that the transfer does not mean that everything has been resolved, because it's a process. So it will take 6 months to allow certain processes happen, to allow the transitions. It does not change the billing structure at the moment, because people are already saying oversight responsibility has been transferred, therefore electricity costs. No, it does not imply that billing has changed. It does not also imply that the distribution company has changed so far. It is a process that will allow the regulatory functions to settle in the state over this period of 6 months. It will also allow the state regulatory commission to go through the processes of setting up the subsidiary companies and organizations that will manage both distribution, transmission, and all of those assets, and then clearly take over the assets over a period. So it is a process. So I agree with you, correct. The regulatory responsibility has been transferred, but it's a 6 months process, and we must allow it take its course. The agency is already at work, and they are doing what they need to do. His Excellency the Governor made this very, very clear on the day he inaugurated the agency, which followed first the enactment of the state electricity law, and thereafter the state electricity policy, and then the electricity summit that outlined the stages of actions that will lead to Akwa Ibom taking over its electricity market. And the governor gave the commission an 18-month target to go through this process. And of course, that is on, and we must commend the agency for beginning to show that the target given to that they've started working, and the things expected of them are being done. Thank you very much. And Osuni asked a question about the Boom Deep Seaport project. I can announce to you that the project is on course, and nothing will stop it from being implemented. The governor of Akwa Ibom State made it very, very clear that he is committed to that project. All we're asking for is the continued cooperation and support of the people of Akwa Ibom State, the people of the various communities surrounding the Boom Industrial City and Deep Seaport area, so that we can have the requisite support to allow actions to be taken. Processes have started, access roads are being constructed, and of course, investors are being sought to ensure that this works out. And I must explain here that a deep seaport project is not a tea party. Everybody should understand this. Take the Lekki Deep Seaport, for instance. It took 22 years of private sector ownership, driven even when it is Lagos. The holding of that company, 65% belongs to one company, the China Harbour Company. I must say this clearly because it's factual. And then, of course, other companies are involved, and then the Lagos State government also, and the MPA, they have holdings within the share structure. So that structure you see there, it's what we're seeking as a state, to find the right type of investors that will work with the state government and, of course, the federal agencies like the Nigerian Ports Authority to bring that project to reality. Anybody who thinks that it's just a flight by night, no, should go and check. It's a very serious, very serious. I thank you so much for those two. Is there any other thing? I think those are the two issues raised. Do we have any other question? Yeah. So on that note, I want to thank you so very much, and I saw one of our brothers, Victoria, the STV journalist, now reporting from the U.S. coming. We are happy to have you in the house. Thank you, Victor, for coming, and so on. So on this note, I will yield to the Chief Press Secretary, and thereafter we take comments from the Chairman of the NUJ. Thank you.
The Honorable Commissioner for Information, my brother Elder, Right Honorable Elder Ede Kadomana, PhD, the Honorable Commissioner for Health, Dr. Akem John, the Chairman of NUJ, Akwa Ibom Council, my wonderful brother, Comrade Nsibet John, the DG of AKBC, all the aides of the governor, led by Dr. Sendroso, and the immediate past chairman of NUJ Akwa Ibom Council, my in-law, Comrade Emosetuk, and my colleagues, gentlemen of the press, and of course, Victor, it's so good to see you. You and I have been communicating on social media, and you look well. America has been pretty good with you, and you're living it up. So welcome. Well, our time is far gone, and I want to As always, thank you for responding at such short notice for this press briefing. You've all listened to the Honorable Commissioner for Health, the one that I call a journalist in quote with a stethoscope, given the ease and facility with which he has been dealing with the media. It was until a few years ago when he was tapped by His Excellency to be his PG or personal physician, and eventually performing this wonderful role as the Honorable Commissioner for Health. He was the spokesperson for the Akwa Ibom State Council of the Nigerian Medical Association. But he has a wonderful relationship with the media space in the state, and well, you can see why he is that well loved by the media, because check out his erudition and check out the ease, like I said, and facility with which he really loved the facts. Well, you've all listened to the wonderful things that His Excellency is doing in the health sector, and I want to believe that you are going to go out there, as always, and do a wonderful report. Wonderful things are happening across sectors in the state, and it all speaks to what I've always said. And Victor, you will understand there is the American exceptionalism. We also have the Akwa Ibom exceptionalism, and we are being led by one of those that has deepened the Akwa Ibom exceptionalism, and that is His Excellency Pastor Umwana, PhD. So the Akwa Ibom people are invested in Akwa Ibom journalists are invested in the development of the state. And as we look forward to celebrating 39 years of our founding, I know that they will wear the Akwa Ibom exceptionalism like a badge of honor. So on that note, I thank you guys for coming. And I know we're going to, in the next couple of days, or in the next couple of hours, see some wonderful sanitized, keyword sanitized reportage. Thank you and God bless you all. And I yield the microphone back to the Honorable Commissioner for Information.
Yeah, thank you very much, my brother, the Chief Press Secretary to the Governor. At this point, I think the State Chairman of the NUJ will give us a few notations. Mr. Chairman.
Respectfully, the Honorable Commissioner, Minister of Information, All Commissioner, Minister of Health, the Chief Press Secretary, aides of the Governor led by the Dean, the Director of Information, Minister of Information, very distinguished colleagues here. The Governor had earlier declared that this is going to be, next month will be a month of gratitude. And I'd like to key into that prophecy immediately. I'd like to commend you, sir, Honorable Commissioner for Health, on your innovation in the Ministry of Health. I think your activities in the ministry had earlier earned you some applause from the zonal leadership of NUJ. And as students of that school, we stand under that particular submission. One of the most important innovation and initiative of His Excellency's administration in the health sector is the health insurance scheme, because that particular scheme has covered almost everybody in Akwa Ibom State that wants to identify with it. For us in the NUJ, a lot of our members are also captured in that scheme. And I'd like to also bring to your notice that if you have any concerns or any report or any complaint, we will definitely reach out to you. But so far, I think it is safe to score you 90%. And we also gladly hope that you are going to do more for Akwa Ibom people. I also like to thank you because you have always involved the media community in every activity in your ministry. For instance, I remember when you were investigating the case of the Korek Bene General Hospital incidents, you asked for a nominee from the NUJ and we sent to one. Just recently, we received a letter from your ministry again asking for a nominee into the Akwa Ibom State Emergency ambulances. Yes, and then by the grace of God, we've also been able to send you a nominee. It is our belief that this partnership will deepen the fabric of our cooperation, and rest assured that the media in Akwa Ibom State will continue to report professionally and in all ways to ensure that we uphold the story of the Akwa Ibom exceptionalism. Thank you very much.
Thank you so much, the chairman of AUJ. Gentlemen of the press, as we begin to wrap this up, or as we wrap this up, I'd like to let you know that in the month of September, we will be having more of these briefings. We will have more of these briefings. We will have more honorable commissioners representing various ministries also come out and share data and statistics, because His Excellency, the Governor of Akwa Ibom State, Pastor Umono, is very big on data, and he's made it very clear that every ministry must harvest its data and provide clear, verifiable information, numbers and data as to what they are doing and match it against how it impacts the people of Akwa Ibom State. So with the appointment of the new Statistician General and the strengthening of that bureau, and from what you have seen here today, from the presentation of the Honorable Commissioner for Health, you can see that we are walking the data talk of His Excellency Governor Umono, and we thank the Governor so much for this opportunity. So be charged, Mr. Chairman, AUJ, please put your team together, because there will be a lot more of this engagement, particularly in the month of September. It won't just be one. By the Governor's directive, I'm expecting that we will hold a lot more briefings so we can put the numbers and facts to some of the accomplishments that have been recorded by this administration so far. I thank everyone for coming. And like the Chief Press Secretary said, let's go to town. And then let's go to town with the clarion message. Let's take everything we have heard to town. Let nothing be left out. We thank you so much. But remember, let breaking news not break the society. God bless you.